So I want to welcome you all to another session of What's Up Wednesday. Today we will be talking a little bit about the stimulus checks that are coming in response to the COVID crisis that our country is experiencing. Some of you have had an opportunity to receive yours already, some of you haven't. I want to give you a little bit of information about what's going on and why that's the case. But just want to start with a fun little poll first about what you plan to do with it. So this should pop right up on your screen and you can give a quick response. And it says, what do you plan to spend your stimulus money on? And you can check as many as you like. You could say, I already spent it. I'm going to pay off a credit card. I'm putting it toward rent or mortgage. I'm going to fix my car. I'm going shopping. I'm giving some of it away, either to a family or a charity. I'm going on vacation. I'm going to invest it, or other. And if you have an other that you want to pop in the chat box so that we can enjoy others' ideas, that'd be good too. So let me see if I can share the answers here. There's another other down there on the bottom. So I'm with you guys on the top there. I already spent mine, actually. My husband spent mine. He's quite good at that. But I see there's a couple of other, paying off some debt and taking an opportunity to go shopping, catch up on some things that maybe we didn't have money for before. And that's part of the intent of it, is to make sure that people are getting what they need, particularly if their income has been interrupted. So let me switch gears here real quick and share some info with you. Okay, so I'm hoping you can see that on the screen. What's Up Wednesday? Stimulus to spend or not to spend? Is that what you see?
Yeah.
Okay, super. So the stimulus package was signed into law in March. It's a $2.2 trillion stimulus package. It offers adults a one-time, they're calling it a rebate of $1,200. You can get up to $500 for a dependent child. There are some expanded unemployment benefits, and we'll talk a little bit about those. And then, of course, some relief for small business owners. There is a phase out for folks who make between $75,000 and $99,000. And essentially for every $100 over $75,000 that you earn, the payment decreases by $5. If somebody is a head of household, then their earning limit is a little bit higher. But a head of household essentially means it's a person that's unmarried, paying more than half of a household's expenses and claiming at least one dependent. So that might not apply to many folks. There are some perks of the stimulus. It does not count as taxable income, so you're not going to have to report it next year. You're not going to have to pay it back. And if you happen to owe taxes or owe back taxes, the feds cannot keep it. So it's money that's for you. There's always an exception to a rule, and there is one to this one as well. If you are behind on child support, the IRS says it can offset the stimulus check by the amount that's past due. And so just be aware that is the case. Of course, one of the things that you might want to keep in mind is if you do owe taxes, you might want to hang on to it and spend it on that. They did move the deadline for filing federal income tax this year to July 15th. And if you owe, you can certainly set up installments with them. They'll work with you on that. A couple of important notes about the stimulus and what it might impact. If someone receives a stimulus under the unemployment section of the benefit package, it will not be counted when considering asset limit for Medicaid eligibility, but it might impact other benefits. So if there is an asset requirement for some programs, this could be taken into account. And I'll give you a couple more details about that on the next slide. So the additional $600 benefit counts as income when determining eligibility for means tested programs, except for Medicaid and CHIP, which is the Children's Special Health Insurance Program. I think I interrupted a slide here. Let me see where So we were hearing now that stimulus checks should arrive by mid-May. The IRS says that veterans and folks on SSI have until May 5th to claim children as dependents in order to get the $500 dependent credit. Again, we've got those income limits about what you reported on your taxes. If you didn't file your 2019 taxes yet, they will look at your 2018. So there were some questions about if SSI beneficiaries had to file taxes or not. They would need to originally needed to report as a non-filer, and there was a place to do that. There's a web tool, but that has changed. So SSI beneficiaries who typically aren't required to file tax returns would either need to file one in 2019 or register for a stimulus payment, but that's changed. So the new guidance from the IRS grants $1,200 in stimulus payments automatically to SSI beneficiaries. So there's no need to file any additional paperwork right now. The Social Security Administration has assured that SSI beneficiaries that stimulus payments would not count as income for SSI recipients, and the payments would be excluded as a financial resource for that calculation, the means based for 12 months now. So that's good news. Any questions about that? Okay, a little more clarity on benefits. Again, the Department of Social Services wants those who receive Medicaid, food stamps, child care assistance, or TANF, temporary assistance for needy families, to know that the economic stimulus they receive will not be counted as income as long as they spend it within 3 months of receipt of the payment. So those are other means-based programs, and they've given you some leeway so that you can plan to spend for that.
Hello, how are you? Kind of hard to spend that when you can't go anywhere and there's no stores open.
My husband would say everybody's ordering things. So that is one of the reasons they're looking at reopening certain areas of business as well, so that folks can get access to what they need, and so that can be spent and not jeopardize anybody's existing resources.
Terry, do you see anyone in your waiting room?
Oh, can we drop? Can I go with John?
Do not. Oh, one person is waiting. Hang on. Thank you. Okay, they're on their way. Thanks for the heads up.
Thanks.
So in regard to the unemployment benefit, the additional $600 per week is not going to reduce any unemployment benefits or PUA, which is the Pandemic Unemployment Assistance. Workers' compensation. Some people say, well, what if I got COVID? Is workers' compensation going to cover that? And that might be the case. If injury or illness arises out of the course of employment, then that could be applicable. So those rules are a little bit different, and it's a whole different pot of money than the stimulus. So and some folks have been asking about the unemployment benefit as well. Again, it's separate than the stimulus package, but it certainly could be income that people are concerned about. If you were denied unemployment benefits, you could be eligible for Again, that PUA, and you can do that right on the unemployment website. I think it's Marvin for the state of Michigan. Is the reporting tool. Again, so that's pandemic unemployment assistance is what that stands for. If you checked before to see if you were eligible for unemployment, there's a new system in place now. So if you didn't see the link before, you should be able to see it now. Okay. If, again, I mentioned I'm sorry to back up a second, the workers' compensation piece. In most cases, if there's a clear connection between work and the injury or illness, that it's going to be covered. But that's hard to tell right now because we don't have contact tracing. And so if it's COVID related currently, that may be questioned. So just be aware of that. Okay, scooching forward a little bit. Individuals are eligible for that pandemic unemployment assistance if they don't qualify for unemployment under benefits because they cannot work. And so there are a number of people that might fall under that category. Might be somebody who's diagnosed with COVID or has symptoms and are currently seeking a diagnosis. If they have a member of the household who's diagnosed with COVID and so have to be quarantined. If you're providing care for a family member or household member diagnosed with COVID-19. If you're the primary caregiver for a child whose school or care facility is closed due to COVID-19. If you're unable to reach your place of employment due to an imposed quarantine or advised by a medical provider to self-quarantine, then those are some reasons you might be eligible. If you were scheduled to start new employment and cannot reach the workplace, that would be another reason. If you became the major breadwinner because the head of household died from COVID-19, you had to quit your job, you had your place of employment closed as a direct result of COVID-19. And then there's a few other special criteria identified by the Secretary of Labor. So those are, again, reasons why folks might qualify for that pandemic unemployment assistance. In most cases, individuals are not eligible for that if they can telework or are receiving paid sick leave or other benefits from their employer, even if they fall under one of those categories. So it's about income for folks. I know that was a lot of examples, but I wanted to make sure I was thorough in listing those out for you. Any questions about that program?
Well, I have a question. Do they back pay for people?
I think it goes back to March 13th.
Huh, okay. And what is the part about underemployment?
That's in the unemployment rules, so that's not impacted specifically by COVID, and that's based on hours that were previously worked, and if work had been refused. So that's an unemployment formula. I don't know that one off the top of my head.
Because they had some people that were off work because they were quarantined and they were paid just a percentage of their pay, but it wasn't enough to live on. And so the term came up as underemployment. And so I guess the question is now, can they go back and file for the underemployment?
I mean, based on the example you're giving, I would think so.
Okay. Okay.
Oh, me and Brad. Because Brad is
Okay, so we have
getting
with
paid, but
a couple of experts in financial planning folks, and want people to begin to think about, well, when I get this money, what am I going to do with it? And so there were a few recommendations from financial planners that I wanted to share with you. you can see on the screen that says the first recommendation they have is to immediately start an emergency fund. And even, people say, well, I can't get to the bank to open an account. There are actually some online savings accounts, and some of them offer annual percentage rates up to 1.7%. A rainy day account, they recommend that people have enough to cover expenses for 3 to 6 months. I know that most of us don't have that, and so this might be a good time to start that. And when you think about your rainy day fund, that should include enough to cover rent, mortgage, and utilities for that period of time. If you've already got a rainy day fund, several advisors recommend paying down debts, particularly credit card debt. The top focus should go to credit card debts with an interest rate of 8% or above, which is most of them. Our average annual percentage rate for a credit card last November was almost 15%. Let's see, one exception that they say in regard to paying off some debt is student loans. They initially said, hang on, let's see what they're going to do with that. And again, have made some decisions that borrowers can put payments on pause for student loans for 6 months right now. And that's that it's waiving collection interest on the loans for right now as well. And so it's up to you, obviously, what you spend it on, but that might be a reason to look at something besides student loan debt, because we've got a little bit of a grace period on that. A third recommendation was to invest it. I'm not a financial planner, so I couldn't speak to what a good opportunity might be, but a couple of recommendations that are out there are to look at equities. Equities are down about 32% from all-time highs, which makes them a cheaper purchase right now. If you want to do that, however, they recommend that you start slowly, investing a little bit at a time, whether it's on a weekly or monthly basis, partly because we might have some more financial downside coming. Nobody really knows right now. And so just approach that cautiously. They say this could be a really great time, but let's see what else happens. Others suggest putting it into companies that are already benefiting to some degree from the pandemic, like virtual learning sites, business iCloud infrastructures, video games, grocery stores, groups like that that are already in business. They also talked about an ETF, which is an exchange traded fund. It's a mix. And so that gives you a lot of exposure to a bunch of different industries at one time. But, that kind of fund provides growth opportunity for the future, but also offsets the risk of buying it into each individual company in case one of them, let's say, files for bankruptcy, then you're not at as great of a loss. So it sort of minimizes your risk a little bit. And then the last suggestion for spending is to donate it. If you're able to do that, there are a lot of hourly workers out there, retail clerks, restaurant staff, hairdressers, who saw their income pretty much go away overnight. But their financial obligations obviously did not. And stimulus checks are helping, but that's not going to bridge the gap for very long. So there are food banks and other nonprofits that are seeing a rise in the demand for services. All the nonprofits in the area are seeing almost all of them, are seeing a demand for their services to increase, but nobody's budgets got any bigger. So we do have some relief for some services through the CARES Act, but again, that's going to be time limited for now. And so if you've kept your job and have an emergency fund, or if you've got an extra means, you might want to consider donating some of that if there's folks out there who maybe weren't as fortunate of a situation as you. So those are 4 suggestions that folks have recommended. And then if you decide, yep, I'm going to spend it, which most of us, it looks like we're going to try to do, there are several groups out there, lots of webinars that will help you begin to make a spending plan. Michigan State University, MSU Extension has several coming up. I know we've sent out some resources about that. But there's some key recommendations that come out of those resources. And I've hit some highlights on the screen for you. And the first was to take stock of family and community resources. So as much as we want to go shopping and stock up on things, there might be some access to resources already that if we had those resources, we might decide to spend our money on something else. So take a good look at what resources are available to you. And then it said recognize changes, even if they're temporary, and what impacts they might have on your household. So am I having to pay more right now for water and electricity, for example? How long am I going to be able to sustain that? Should I be, putting more in that pot than I normally would? Set some spending priorities. A lot of times that's a discussion as a family. Here's all the things we want to do. What makes the most sense? And again, this is a great time to pay some debt off because we've got that sort of windfall of cash. Watch out for scams. I'm going to talk about some of those and just on the next slide, actually, and then make a plan. So we are seeing a whole bunch of scams pop up right now, and I want you to be aware of a few that are out there, not only for yourself, but for folks that you might know, because unfortunately there are some people that take advantage of situations, and we've seen people lose money. And when there's money out there to be taken, scammers get busy. So one of the things we're seeing right now is people trying to sell cures, vaccines, testing supplies, and those things, many of them have not been approved yet. I saw last week that Quest has got a home test coming out that people can buy, but that's the only one that I've seen that's from a reputable company, and I'm not sure, what the success rate of that is, if anybody's heard about that one.
To watch out for.
No,
Not yet. I saw it on one of the federal updates that was going to be one that was coming out, but there's lots of people that claim that they've got something, so be aware of that. Supply scams also have popped up where there are either fake stores or websites, social media saying you can get all these masks or surgical masks and PPE, and so people invest and the product never comes. Provider scams also, people are being contacted by phone or by email pretending to be hospitals or doctors that have treated a friend and are asking for payment so that you can get treatment too. Again, that's you had contact with somebody and so you need to get treatment, and that may not be the case either. Charity scams, again, we've got people soliciting donations for individuals, groups, and areas affected by COVID-19. We're seeing a rash of them in the Detroit area, but that certainly doesn't mean they're not going to spread our direction. And a lot of times, people want to help out somebody, so even if it's not impacted in your area as big, they know that people have generous hearts and want to give. So just be cautious about offering information to charities as well. Scammers posing as national and global health authorities, even including the World Health Organization and CDC, are sending phishing emails designed to trick people to download stuff that then has malware or where they can hack into your financial information. So if it's not something you went out and sought, I would question its validity. We've got some app scams out there as well, mobile apps that are designed to track the spread of COVID-19 so that you can watch, how it's spreading in your area. And again, a lot of those have malware on them or ways that they're going to access your personal information. So be real careful. And then investment scams, again, offering online promotions, claiming that services of publicly traded companies can prevent, detect, or cure COVID, and that the stock of these companies will dramatically increase as a result. We reference a lot of research reports, things like that, that are trying to get you to buy stock into their company because they're going to save the world. And a lot of those are just a bunch of hype. So watch out for scams before you decide to spend money in that, if you decide to spend money in that way.
Yeah, are you stuff?
Yeah. Hey,
Hey,
where's what's her name?
I'm Terry.
Where's Laura at?
She's down there.
Laura,
Yeah.
I'll call you when I get home because I gotta take my stuff home.
Okay.
Okay, I'll call you back when I get home.
Bye-bye.
See you
Okay,
later.
bye.
Bye.
I'll call you back when I get home. Okay.
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 Okay, and then the next thing we are getting a few questions about is, when is the stimulus check coming? There's a few reasons that folks might not have gotten theirs yet. And a bunch of them are listed here. It might be the IRS doesn't have your bank information. Either you didn't file for some reason, or you didn't have it direct deposited. And you can go right on there's a reporting tool on the IRS where you can give them that information. It might be because you make too much money. It might be another reason that's not listed here is you moved and they don't have your most recent address. You can update that online as well. If someone else claimed you as a dependent, there are a few things in regard to tax filing that can cause some delays as well. So some young adults, for example, might not get the stimulus money because their parents claim them as a dependent. IRS counts a dependent age for this package at 17 and under, but they're only reviewing the 2018 returns right now unless you've already filed. So if someone, for example, was in high school in 18, they wouldn't have been eligible, where now if they're in college or older, they might. So an example might be if, let's say, there's a 19-year-old college student right now whose parents claimed him on their 18 return, he could still be eligible for the stimulus payment for himself because of the 19 return. So you might just need to touch base with the IRS and say, hey, I think I'm really eligible. Let's see. Some national tax preparers were offering advance refunds to folks that they could load onto a debit card. H&R Block, for example, had prepaid cards. And so some of the payments are, if that's how you got your check or your tax return, IRS had some confusion for some accounts and actually paid H&R Block instead of you. And so they're working on getting that sorted out. And H&R Block's trying to get them sent to directly to client accounts. There's a couple other groups, Jackson Hewitt, a few other groups that saw that happen. And then also debt collectors might be taking it. So the CARES Act does not prevent debt collectors from seizing stimulus checks that suddenly come into your bank account. Most financial institutions are offering some grace, but if a debt collector already had a tag on your account, they don't know where it's coming from. They just know that now there's money in that account. So you might want to touch base with your financial institution. Another way to prevent that is if you're getting a paper check, to have it cashed and not deposited into your account, so then they could not tap into it. And then lastly, immigration status. So the government is paying stimulus checks to US citizens and also permanent legal residents. So like folks who have green cards, they would be eligible as well. Any questions about those? Okay. There is a tool that you can use to find out. Let me just get out of this real quick and show you a different screen. There are lots of tools. You can actually just Google this. It says, what do I need to do if I haven't received it yet? How do I find out? What if I don't have a bank account or a prepaid card? Again, I already mentioned what if you moved. The SSI information on this page happens to be old, but right on the IRS website, you can update your mailing address and see what the status is. So that's a pretty easy tool, and it's quicker to get into than calling. Okay. Any questions about stimulus stuff before I kind of wrap up a few other thoughts that folks have been having? Did that help clear up a few who's eligible, where is it kind of questions?
Yeah. We had one question. We've been hearing different stuff, but we were curious if you have to pay that all back.
You do not. It's you don't have to pay any of it back. It won't be taxed later, and you won't have to return that.
Okay.
Free and clear.
Okay, thank you.
Mm-hmm. Well, I just wanted to offer, again, COVID is still a big topic of conversation. It's on everybody's minds. And I know 2 weeks ago, we talked a fair amount about coronavirus and what people's rights were. And I just want to offer a reminder, because since we had that conversation, the governor signed an executive order. Now keep in mind, disability rights have been in place in the law for some time. And so the Americans with Disabilities Act and several other statutes indicate that you cannot be denied care just because you have a disability. But we were hearing a lot of states implement emergency plans that really looked at medical rationing and preventing some people from getting care based on a presumed quality of life rating or life expectancy rating, which obviously put individuals with disabilities at greater risk or more likely to be identified as somebody who might not have one of those things, which that may or may not be related to COVID. In a few states, it was actually written into their emergency plan, which caused us some great concern. On April, I think 29th, Governor Whitmer signed this executive order that just really affirmed that as for the state of Michigan, that healthcare providers need to make sure that the care they provide is equitable and not use rating scales like that. So that was nice to see Michigan just sort of making a stronger stand in regard to disability rights. So we very much appreciated her doing that. The folks are still asking, well, what can I do if I'm healthy and, I don't want to put myself at risk, but there might be some things that I can do to help other people. And there are, again, some recommendations out there about some things that you can do. Obviously, washing hands, we know now that face coverings are being recommended anytime you go out. But you could offer to get some medical supplies. A lot of the groups are still offering shipping, so it can get mailed right to an individual. whether it's food or, again, medical supplies that you want to send to somebody. You can volunteer for a meal delivery, donate money to reputable nonprofits. We just had our Give Local Nonprofit Donation Day. But many nonprofits, anytime a donation is graciously accepted. Giving money to your local food bank. There are a ton of food resources out there. I'm so pleased to see the amount of giving and connecting that people are doing. Nobody should go hungry right now. So if you know someone who's in need, please reach out. Giving blood is something that we hear also, that sometimes people are afraid to go out, and so donations are down. And then again, the folks that are experiencing homelessness are certainly at risk. The most important thing folks can do, again, is to work on stopping the spread of the virus, washing hands, social distancing, quarantining if you feel sick, keeping up on the CDC recommendations. Again, we know that public mask wearing is now a recommendation. But there are certain groups that will feel this health crisis more than others. And so individuals who are older, maybe workers that have to go to work and can't call in sick, or are considered essential workers or performing what's now going to be called a safe activity, or people who can't pay for healthcare simply don't have access to it. And so we're not all, receiving the same kind of support. So if there are things that you could do to contribute, because the folks who are the most vulnerable among us are going to be the hardest hit and take the longest to recover. And there's, I think, some things that we might be able to do to support each other during this time. We also shared the hotline. This is a national hotline. If somebody is discriminated against or denied care because of a disability, again, that's illegal. And there are folks that are here to help. So make sure this is on our website. So if you don't need to screen clip it right now, but know that that is a resource out there. It's a national resource. And then one of the conversations that people are having is, what's it going to look like? What's the new normal going to be? When are we going to be able to hang out and have a barbecue? Or, do I have to wear a mask forever? I know some people don't want to go out just because obviously the stay-at-home order is still in place now, but even after that, because wearing a mask is uncomfortable. And for some people, it's a sensory hardship even. So these are just a lot of the questions that are still, popping up. What do I have to do differently? How is life gonna, how are we gonna function with each other? And we don't know the answers to all that stuff yet. And it seems to be changing all the time. So we recognize that there's, some uncomfortable anxiety that comes with the not knowing. And we just want you to know that we're here for you. So if you have questions or things that you want to talk about, Disability Network staff are still working. You can encourage anybody to call. Again, there's a warm line also at the state level for people who are feeling anxious. We share that information too. So know that those resources are there for you and for anybody who may need them. Then I'll just pop back up to my cool window. Hi, Jan. And Walt joined us too. I didn't see you sneak in, Walt. Okay. And I got a chat coming in. And a
Okay,
sneak.
have a good day.
What's that?
Have a good day.
Thanks, Mike. You too. So if I start sneezing, forgive me. It's my favorite allergy season. So, okay. So what are folks, whoops, I'm sorry. Has that been up on the screen the whole time? Are you seeing a poll still?
No.
Oh, good. Okay. All right. I'm going to throw one more up there. One of the things we're going to be asking through our gatherings is what social media platforms you use. If you're on here today, obviously you figured Zoom out, so that's great. But what other kinds of social media are folks using? And part of this is we want to make sure if we're sharing information that it's in a platform that is useful for everybody. So if you would fill that out real quick. So there's several choices up there. Instagram, Pinterest, Facebook.
I don't see it, Terry.
You don't see it?
No.
Oh, boom. How's that?
There you go.
Okay. Details, right? So Instagram, Pinterest, Facebook, TikTok, Zoom, WebEx, GoToMeeting, Skype, Microsoft Teams. And then if there's any other ones, please let us know. Okay, so it looks like we're on the right path right now, although I will have to see what we can tackle with Pinterest. Isn't that just pinning pictures?
You can buy stuff on it. You can get information. You can share. It's actually a lot more than it used to be.
Okay, well, we'll check it out. I know we use Facebook and Zoom quite a lot. We've used a few of the other meeting platforms, and we have our Instagram pinned or tied to our Facebook messaging now. So, but we'll have to check out Pinterest as well. Thank you for that. Okay, any other thoughts, comments, worries, questions?
I don't think so. I think you covered everything pretty well.
Okay, I know there were a lot of little details in there too, but we want to make sure that we kind of cover all the bases and give folks some recommendations about what you might do with it when it comes if you haven't had it yet. And just an opportunity to share ideas with others too. So I appreciate you taking the time to hang out with us today.
If
We
people
will.
watch this video afterwards and have a question for you, how do they contact you?
We always have an open forum on the website for folks to send questions to us. It's on our contact page on the face or our website, and they can always send messages through the Facebook page as well.
And when will this be posted?
That I don't know the answer to, just because of the file transfer. My hope is that I'll send it to Matt today and he'll edit it and have it up tomorrow, but that's our hope. I can let you know that for sure when it's ready.
Okay.
I do have a question.
Sure.
Okay. How, like, people that are on Social Security, they only have so many months to spend this money. But what if somebody withdrew it from their account and put the money into another bank account at a different bank? Would that still affect it?
It would be still considered an asset, and so it just depends on if it's one of those means tested eligibility programs. So again, they give you that leeway typically to spend it. So whether it's 3 months or there's a couple of them in there that they're not going to count it for a year. I mean, if you can hang on to that kind of money for 3 months and not spend it, but if you have more than one bank account, they still you're asked to report all that as assets. So I'm not sure what kind of safe fund you could put it into that wouldn't count. I mean, like different than a bank account. So I don't know if folks have suggestions about. There's not really enough to make a trust out of that. So,
Jan, are you talking about putting it in a joint account with Joel?
Well, yeah, because my Social Security goes into my main account that's Members First Credit Union, but I don't know if that affects your Social Security. Because I know that I found out that you only have like 3 months to spend this check that you end up getting. So I don't want it to affect my Social Security at the same time.
Well, and so here's the thing, you're going to spend a little bit of it and you're going to save some of it, and you spend your Social Security every month. So the idea is that you stay under 2,000.
I can do
You should be okay.
that. Okay.
It shouldn't impact, if you're thinking about it, changing your Social Security benefit amount, that shouldn't impact that. The only time it's going to be after that 3-month window is for the asset-based programs.
And you're getting married now. You've moved your wedding from July to October.
Yep.
So, whenever you get it, June, July, August, you're going to be close enough that you should be okay.
Okay. You can do all that.
Okay.
All right. Any other thoughts or questions for the good of the order? All right. Have a great rest of your Wednesday. We'll see you next week.
You too.
Okay, thank you, Terry.
Terry.
Bye now.
See ya.